Bismillahirrahmanirrahim. In this session, we are going to speak about the hip bone. Hip bone consists of three parts: ilium superiorly, ischium inferiorly and posteriorly, and pubis inferiorly and anteriorly. Both hip bone in the right and left side anteriorly are going to articulate to each other through interpubic cartilage and make the symphysis pubis. As you know, the symphysis pubis is a kind of cartilaginous joint. About the hip bone, as I explained for you, the ilium, pubis and ischium are going to form the hip bone, and these three parts are going to attach to each other, to fuse to each other in the acetabular fossa. Acetabular fossa is a cup fossa. It is a fossa that the superior part and the proximal part or the head of the femur is going to articulate inside of the acetabulum with the hip bone and make the hip joint. As you know, the hip joint is a kind of synovial joint. To be able to distinguish that this hip bone belongs to the right side or left side, you can use from some landmark, such as the superior border, superior margin, called the iliac crest. The iliac crest has to be found for upward and superiorly. And also you have to be careful to put the acetabulum to lateral side. If you notice, you can find 5 borders in the hip bone: anterior border, superior border or iliac crest, inferior border, posterior border, and medial border. When you notice to the posterior border, you can find 2 notches. One of them called the greater sciatic notch and the other one called the lesser sciatic notch. When you are going to distinguish this hip bone belong to right or left side, you have to be careful about these notch, greater sciatic notch and lesser sciatic notch. Both of them has to be backward in the posterior border or posterior margin. About the ilium consists of the lateral surface of the ilium called the gluteal surface. At the medially, you can find the iliac fossa. Iliac fossa is a site for attachment of the iliacus muscle. Also, the sacropelvic. As you know, the superior to this forceps, you can find the ilium. So the small portion, a small part of the small or true pelvic region, pelvic cavity is going to be formed by the ilium. So we can call sacropelvic surface. Sacropelvic surface of the ilium. In sacropelvic surface, you can find 3 parts: auricular surface, iliac tuberosity, and pelvic part. The pelvic part of the ilium is going to form a small portion, a small part of the pelvic cavity. About the auricular surface, this auricular surface is a site for attachment with the sacrum and make the sacroiliac joint. As you know, the sacroiliac joint is another kind of the synovial joint. And the iliac tuberosity is visible between the auricular surface and the posterior part of the iliac crest. Or we can explain the iliac tuberosity is going to be found superior and posterior to the auricular surface. This iliac tuberosity is a site for attachment of some of the ligament. About the iliac crest or superior margin, superior border of the ilium or the hip bone, you can imagine all part of the iliac crest is going to be formed by the ilium. It is going to be anteriorly begin from the anterior superior iliac spine, and it is going to be continuing posteriorly to posterior superior iliac spine. When you are going to look at the iliac crest from superiorly, you can find it is such as the S in English, that you elongated this S form. And so some part is concave and some part is convex. About the iliac crest, as we know, you can find three crests, and all of these crests or this line is the site for attachment of the muscle or some of the ligament. Only a small portion of the iliac crest is free, and this part is part of the lateral crest. Lateral margin is free, and anteriorly you can find attachment of the external oblique. Posteriorly you can find the attachment of the latissimus dorsi. This part is going to be made the base of the lumbar triangle. About the anterior border of the ilium is going to form the anterior superior iliac spine, anterior inferior iliac spine, and iliopubic eminence. Iliopubic eminence is the eminence that is going to be formed by the ilium and the pubis. Both of them are going to form the iliopubic eminence. About the posterior border, look at to the posterior border. Superior posterior iliac spine, posterior inferior iliac spine. Immediately inferior to this spine you can find a greater sciatic notch. This greater sciatic notch, most part of the greater sciatic notch is going to be formed by the ilium. Inferior to the greater sciatic notch, this part, this inferior ramus, the distal part, the inferior part is going to be formed by the ischium. Now look at to the medial border. In the medial border, I'm going to show you the arcuate line. Arcuate line is going to form the small part of the medial border. This part belongs to the ilium too. About the pubis, pubis consists of the body and two ramus, superior rami and inferior rami. Inferior rami is going to fuse with the ramus of the ischium and make the ischiopubic ramus. The superior ramus is going to participate to form the acetabulum. About the acetabulum, you have to know the ilium, pubis, and ischium. All of them are going to participate. But about the obturator foramen, only the ischium and pubis are going to participate to form the obturator foramen. And never you have think about the ilium. About the body of the pubis consists of three surface: anterior surface, medial surface, and posterior surface. Posterior surface also called the pelvic surface. This surface is going to form the anterior surface of the pelvic cavity, and through the rectus fossa or retropubic fossa, this posterior surface has connection, and it is adjacent to the urinary bladder. The medial border is going to form the symphysis pubis. The body superiorly consists of the pubic crest, and lateral to pubic crest you can find a tubercle, a small tubercle that's called the pubic tubercle. As you know, the inguinal ligament is going to attach to pubic tubercle. About the inferior ramus consists of two border and two surface: anterior surface, posterior surface, inferior border, and superior border. But in anatomical position, you have to know it is better. We think that the inferior ramus consists of two borders: medial border and lateral border. Medial border is here, and lateral border is going to form small part of the obturator foramen. Medial border of the inferior ramus from both sides are going to form an angle exactly immediately inferior to this symphysis pubis. This angle we call the subpubic angle. Subpubic angle in female sex is about 80 to 85 degrees, and about the male sex it is about 50 to 60 degrees. So in the male sex this angle is very small. About the superior ramus. Superior ramus of the pubis, you can explain and you can find three border and three surface. Superior border or superior margin or pectineal line. Anterior margin or anterior border or obturator crest, and inferior border. Between these three borders, I am able to explain and introduce three surfaces. This surface is triangular and we call the pectin surface. This surface is a site for passing of the obturator neurovascular bond, and another surface will be here between the superior border and inferior border. In the male sex, this pelvic or posterior surface in the male sex has relation, is adjacent to the spermatic cord, and in the female sex it is adjacent and has a relation with the round ligament of the uterus. Now we go to posterior inferior part of the hip to be able to explain the ischium. Ischium is such as a L in Latin, in English. The vertical part we call the body, and the horizontal part called the ramus. Ramus of the ischium is going to join to the ramus, inferior ramus of the pubis, and make the ischiopubic ramus. About the vertical part, the body consists of three borders: anterior border, lateral border, and posterior border. Between these three borders, I am able to introduce three surfaces. Femoral surface, and this surface is between the posterior border and lateral border. This surface, if you notice, you can find ischial tuberosity. Ischial tuberosity is between the lateral border and posterior border of the body of ischium. And here you are able to find the pelvic surface. Pelvic surface is going to form the lateral surface of ischioanal fossa. About the body of the ischium, if you notice, you can find the lesser sciatic notch and superior to lesser sciatic notch. I am able to show you a small spine that called the ischial spine. Ischial spine is a small part of the ischium. As I explained before, to form the obturator foramen, only the pubis and ischium are going to participate. To form the acetabular, the ilium, ischium, and pubis, all of them participate. Look at to the acetabulum. Acetabulum, in the peripheral part, you can find lunate surface. This part is articular surface and called the lunate surface. And the central part is non-articular surface. As you know, the ligament of the head of femur is going to attach to this central part of the acetabular. And inferior to acetabular fossa, you can find a notch that called the acetabular notch. You have to know the acetabular notch and the obturator foramen position are inferior compared to the acetabular.